Hello, ladies and gentlemen. Welcome to Brain Gist. Today, I want to address the issue of misuse or wrong use of a medication called Imigran in the treatment of migraine. Quite a lot of you who've got migraine are very used to this medication because in so many countries of the world, it's an over-the-counter medication, which means you can easily walk into the pharmacies and purchase Imigran or Sumatriptan tablets. And I know some people use it to even make a diagnosis of migraine. So if you use Imigran and the headache improves, then it helps some doctors to confirm that you truly have migraine. So this medication certainly is powerful, effective in stopping headache attacks, and therefore people tend to use it. But a lot of people do not know how to use it correctly to avoid harmful effects. And this is what I want to address in this short video clip. So in case you're new to the channel, I welcome you. It's Brain Gist. It's a channel dedicated to educating people about the brain and its disorders. So you would find it very useful, and consider subscribing, sharing the videos with your friends so that they can also benefit from all you're going to be learning from this channel. So I'd like to hear your comments, feedbacks, and all of that. So back to the topic, and that's Imigran. So a lot of my patients certainly talk to them about these medications, and therefore they'll find this video like refreshing, and that they can actually use it to remind themselves of some of the things we talked about in the clinic. So Imigran is no doubt a useful medication to help stop headaches of migraine. There are important caveats you need to know if you're using this medication. So first of all is that it's a migraine specific medication. It means if you do not have migraine, so you shouldn't have any business using Imigran tablets. So the headache you have needs to have been reviewed by a qualified doctor who's knowledgeable enough about headaches to confirm that what you do have indeed is migraine. It's because it's not all headaches that are migraine, so you need to be sure that what you have is indeed a migraine, and then therefore it's going to be useful for you. And then the second thing is that there needs to have been a check to be sure that you don't have cardiovascular disease. So cardiovascular diseases such as heart attacks or strokes in the past, or in the absence of previous heart attacks and strokes, if you've got a very high risk of developing these conditions, you would not be a suitable candidate to use Imigran. So of course, we don't worry so much in people who are young, probably younger than 40, but if you're older than 4 or 5, then it'll be important for your risk to have been assessed properly by a qualified doctor before you continue to use Imigran. And the third thing that I talk to my patients a lot about is how not to overuse this medication. So you got migraine and you don't have cardiovascular risk factors, and therefore it's suitable for you. It comes as tablets of 50 and 100 milligrams. So what I say is, whichever one you're using, be it 50 or 100, you don't want to exceed 200 milligrams in a single day. So on a single day, if you've got headaches and you've got to repeat the medication for whatever reason, then you don't want to exceed 200 milligrams. So there are daily limits and there are weekly limits as well. So if you're taking 50, that means you don't want to exceed 4 in a day, and you're taking 100, you don't want to exceed 2 tablets a day. And then you want to ensure that there was at least 2 hours in between repetitions. So that's very crucial. And then when do you repeat that? If you've taken the first dose and the headache somewhat improves but comes back, there might be a need to repeat it. And then in a week, you don't want to take the medication beyond 2 days or at most 3 days. So if you take it for more than 2 to 3 days a week, and then you're at risk, you're probably overusing the medication, you're at risk of having side effects, including worsening of your headache frequency, what we call rebound headaches or medication overuse headaches. So when you reach that threshold of getting more than 3 headaches a week, then you might you need to talk to your doctor. You possibly need some form of preventative therapy. So, which I haven't had the opportunity of making the video on, but I hope to be able to do that in the future. So thank you for watching to the end, and if you did, then of course it means you're interested in headaches, are you interested in neurological problems. We encourage you to subscribe, and so you can follow all the videos that we release in the future. Of course, turn on your notification. All right, so goodbye, and I'll see you in my next video. Thanks, and stay safe.